So, how do you know if you're breathing healthy or not? Well, here's an assessment. It's called the Body Oxygen Level Test, the BOLT score, and it's from Oxygen Advantage. And it measures the number of seconds you can comfortably hold your breath after an exhalation, which is a measure of your degree of functional breathing, hence healthy breathing. You must try not to push beyond the first distinct urges to breathe. So, this isn't a competitive challenge, nor is it a measure of your willpower. All right, so how does this work, this BOLT score? Well, we're going to take a normal silent breath in through your nose and then allow a normal silent breath out through your nose. We're going to hold your nose with your fingers to prevent air from entering your lungs. All right, so we're going to pinch our nose and then we're going to count the number of seconds until you feel the first distinct urge to breathe in. So it's that first involuntary movement of breathing muscles, right? Either your diaphragm or even your throat, because your throat is connected to your diaphragm. So breathing following the breath hold should be the same as before the breath hold, right? So you shouldn't be out of breath. This shouldn't be breathless, because then that means that you've held your breath for too long. So why not hold the breath on an inhale? Well, because it's an unreliable source, because there are differences in lung volume and even in personality traits like competitiveness. Breath holding after an exhalation ensures a more consistent lung volume, both for the individual and measure across a group of individuals. Scientists have proven that holding the breath in this way cannot be influenced by either training or willpower. So this means that the reading is less subjective and more accurate. All right, so where does this all come from? Right? Well, there is a research that was done in 2017 by Kiesel and a few other authors, and the study concluded that the inability to hold the breath for more than 20 seconds generally indicates that a breathing pattern disorder is actually present, hence dysfunctional breathing. Also, that a combination of 4 questions from the functional movement screening and a breath hold time of 25 seconds can be used to screen for the presence of disordered breathing. So in this study, the researchers actually concluded that if an individual passes the screening, there is an 89% chance that they don't have dysfunctional breathing. However, if the person does not pass the screening, further assessment is definitely advised to really get a more accurate understanding of their breathing pattern. So the 4 questions from the functional movement test were: do you feel tense? Do you feel a cold sensation in your hands or your feet? Do you notice yourself yawning? And do you notice yourself breathing through your mouth at night? So it's important to tailor breathing exercise to your own individual BOLT score, because a person with anxiety or asthma will have lower BOLT scores because lung function will probably be compromised. So again, it's very important to actually marry up the exercise with your BOLT score. Now, since 1975, scientists have demonstrated that breath hold time offer a useful index of your sensitivity to carbon dioxide. Why? Because of the relationship between the respiratory impulse and the pressure of carbon dioxide. When we hold our breath, our lungs are not able to get rid of carbon dioxide, and so it accumulates in the blood. The length of time it takes for your brain to react to this increase of blood CO2 is directly related to our body's sensitivity to CO2, our respiratory chemosensitivity. Because CO2 provides a primary stimulus to breathe in, breath holding is a powerful method for inducing that sensation of breathlessness. So the best time to conduct your BOLT score is in the morning, just after waking. A morning score gives a truer measure because it indicates how well you breathe when you can't possibly be thinking about your breathing. So during your first few weeks with these breathing exercises, you should notice an improvement of maybe 3 to 4 seconds in your BOLT score each week. After that, progress will continue at a slightly slower pace. So your Bolt score will only increase when you use these exercises and begin to reduce your breathing volume towards normal. Okay, so what does a low Bolt score indicate? Well, it indicates a greater tendency towards dysfunctional breathing, which is usually associated with faster upper chest breathing with no natural pause in between the inhales and the exhales. And dysfunctional breathing has been linked to a number of chronic health conditions. More specifically, dysfunctional breathing between 1 and 20 seconds on your Bolt score, usually you sort of feel out of breath or have difficulty breathing most of the time, even while resting. There's a high likelihood of chronic overbreathing or chronic hyperventilation. Usually you're a mouth breather, chest breather. Highly likely that you have frequent symptoms such as coughing, wheezing, breathlessness, and exercise induced asthma. Lots of colds, chest infections, and fatigue.